Hi, my name is Wafaa Abdel-Hadi. I am a clinical oncologist and a functional medicine doctor. I started oncology back in 2002. It was like a new, everybody is afraid of cancer because they don't know anything about it. And back then it was like you follow the guidelines, international guidelines. Someone comes, you give him their protocol. But then at the end, in 2013, I lost my father for metastatic lung cancer, and I was doing everything that should have been done. However, I threw out the search because everybody Googles. There was no ChatGPT back then. So I found out about something called functional medicine. So why do we treat people with the same disease, with the same protocol, when they might have a different root cause of the disease? So I delved into the functional medicine, and I got certified in less than 2 years because I was like hungry to get the information in. And I started to implement functional medicine in clinical oncology. And I found out that the results were amazing, not only from the nutraceutical aspect, but from the diet, lifestyle modification, how you optimize your sleep and everything. Then I met in 2015 my partner Patricia Daly, who passed away actually last January from a very aggressive cancer. The prognosis was 5 years. She lived for 16 years. So she was like my miracle, my living proof that a ketogenic diet works, because what actually saved her life and had her live that unexpected quality of, with a perfect quality of life, was a ketogenic diet. And she made a lot of books, and even a book about how to, the ketogenic kitchen. So we joined together forces. So I would see the patient, analyze their root causes, etc., and she would individualize their ketogenic diet. Because ketogenic diet, it's not like people say, it's like, oh, I'm taking keto to lose weight, to look pretty. No, it's a therapeutic diet. It affects every cell in your body. Like here in the Keto Global, they're talking about epilepsy because the brain, like most of it is made of fat. It's good fat. So you need to give your body a good fat. You don't go into a Facebook group or a social media group and learn how to do keto. So I am here and happy that I'm speaking at the Keto Global Conference. I am with the KetoM company because they provide high quality keto food, which I think that it's of utmost importance to people, whether they are in the early stage, because you don't wait until the disease progresses. If you want even to prevent it, if you have a family history, you go on a ketogenic diet modified according to your nutrigenomics. So some people can withstand saturated fat, some people cannot. So according to their nutrigenomics and their how do they respond to a ketogenic diet, you actually individualize the food. So if people are underweight, we optimize their macronutrients to gain weight. If people are overweight, we optimize their macronutrients to lose weight so that they are in optimal health and vitality. I've experienced keto diet myself. However, being a mother of 3, it's very hard to be on it all of the time. But when you are on a ketogenic diet, you have the sharpest mind. You don't crave food. You're energetic. Your athletic performance is higher because it acts on a gene called PPAR alpha, which is responsible for how you respond to the ketogenic diet and your VO2 max, so your exercise and cardiopulmonary functions. So I am blessed as an integrative oncologist, was a clinical oncologist back in Egypt, knowing all of this information. So I hope that the world can listen, attend these conferences in order for just to help as much people as possible, not only from cancer, because I'm an oncologist, but from autoimmune diseases and debilitating non-communicable diseases. First thing is awareness for both patients, medical professionals, and caregivers. It's extremely important, and hence the name of my clinic, Aware. And because when you are aware about everything from the beginning, the repercussions of what you're doing, you will be able to stick to a diet, stick to a plan, do lifestyle modifications, etc. I am very happy that there are more and more conferences are directed towards a ketogenic diet. Some people don't like the word ketogenic metabolic therapies, so we added metabolic. However, it's a low-carb diet. It's a fasting mimicking diet. So there are many ways that you can lower your glycemic index in order for your cells not to crash. Because high blood sugar, hyperinsulinemia. It's responsible for most of the metabolic syndromes and non-communicable diseases. So when first I do educate my patients, and then what we are doing now is that we are educating the metabolic, or how do we say, integrative doctors, because this is not complementary medicine. This is integrative, because you have to bring a ketogenic diet or the right diet to that person, even if it was high protein. It depends, of course, on the nutrigenomics, as we have discussed, but it's extremely important to go to that level so that you can have better results with your patients. Like, I know that clinical trials are being done with the right doctors. They are curating it properly, because you are using the good fats, because which fats are you using, the ratios of it, etc. And how people and doctors should understand that a ketogenic diet or a low carb diet or a fasting mimicking diet, it affects the overall well-being for a person. Their immune surveillance is better, so for autoimmunity. Their microbiota is optimized. 80% of your immune system is in your microbiota. You produce the beta-hydroxybutyrate, so you can actually do your own ketones, of course, but then you can, according to your condition, you can supplement with exogenous according to each one's status. Like, if even athletes, now we have a keto sport conference, because athletes, they thrive better, they get better energy on a ketogenic diet rather than a high carb loading diet before their triathlon or whatever. So I think that if we go there, you will greatly improve the vitality and the sustainability of your treatment protocol for the doctors, and you will have the happiness and the satisfaction of the patient. So I hope that this is the direction that we're going through.